The title of the speech is Healthcare Reform in the U.S., Why It Should Be Free. The speaker is Afnan Sultan, who attends the University of North Florida. The specific purpose of this speech is to persuade the audience why current policy on healthcare is unacceptable and how it should not only be reformed but be free as well. So every year, numerous people, including children, live on the streets without proper healthcare. Healthcare is a right, not a privilege. Everyone should live with life, liberty, and the pursuit of happiness as guaranteed in the Constitution. Without proper medical care, we cannot live without these principles. We cannot have children dying in the streets, and the government should help them turn their lives around. On top of that, not only do companies overcharge, the quality is worse relative to other nations. So healthcare should be reformed and socialized in the United States. To do so, malpractice, quality of service relative to other countries, and the lack of standards must change. So now I'm going to explain the problems in the system, give a solution, and then wrap it up with why it's important. So, bad practices. Wasteful practices such as ordering treatments that are expensive like MRIs, prescription drugs, unnecessary procedures, and underuse of preventive care are all problems. They are a third of American healthcare spending. Due to the massive number of baby boomers, this has put a great strain on the US healthcare system. These people need cares, and doctors often give out expensive treatments because they often give out expensive treatments which are unneeded. So patients have little discretion in the treatments which they want. The patient and the taxpayers have the heavy burden of the costs rather than doctors. Most doctors do wasteful practices because it's easier to avoid. It's easier to order an expensive treatment rather than narrowing down the actual problem because doctors want to avoid lawsuits. This is called defensive medicine. The doctors also do not pay for the treatment, so they disregard the costs. Most medical professionals are sued once in their lifetime, and so they fear litigation as it could damage their career. Therefore, they do whatever it takes to avoid lawsuits. So eliminating malpractice can help save around $1 trillion in annual healthcare costs, as it's a third of the problem. So not only is malpractice a problem, the quality of care Americans receive relative to other countries is not that great. So Americans pay more for healthcare while receiving less treatment than other countries simply because doctors are unaware of the treatment costs of which they give. The US spends far more per capita, $8,508 than any other country. The second most expensive country for healthcare is Norway, with $5,669 per capita, which is far less. The US life expectancy is also less than the Organization for Economic Cooperation Development countries on average, but it spends far more, meaning that the quality of care is less over here. The US also has no proper care set by government, unlike other countries, which causes variations within the system. So the US spends about a fifth of its GDP on healthcare while being half as much as other countries at almost twice the average. Emergency care is also much higher than other countries, almost 2.5 times more than Switzerland, Canada, Germany, France, or Japan. The US spends 60% more on hospital spending than those countries. The US also spends much more on pharmaceuticals, and while public health and administration is much higher than those five. So the US spends substantially more on health services than others, which is an important indication of healthcare costs. And so now you know what the issues are, so I'm going to argue why the system should be fixed. The US is also a highly industrialized country, and there should be no reason why there are healthcare issues, considering that the American GDP per capita is more than $50,000 US dollars. The government should also provide a degree of benefits to all citizens, such as medical care, pensions, unemployment insurance, disability payments, maternity benefits, and more. Government-provided health care would also compete with private plans on cost and reduce the amount of uninsured people, which prevents bankruptcies. Bankruptcies are bad because, let's say someone who can't afford healthcare and is uninsured, they go in for emergency treatment, they won't be able to afford it, so the healthcare companies will put the burden on other taxpayers and on other patients, which do have money, which is unfair. So a proper medical system would create better living standards for Americans, and this would also put us on par with other nations. And so the question is, does the Affordable Care Act or Obamacare work? And how can we pass legislation to fix these issues within the healthcare system? So the American healthcare system has many holes. Obamacare was an attempt to fix the issues in the system, but it was unsuccessful because politicians bickered and they often tried to repeal it rather than attempt to fix it. US healthcare should be fixed and be made free, so better practices, standards of service, and the need for better quality of life should be considered. We should support legislation aiming to fix the system and to socialize healthcare rather than opposing it, as this is a humanitarian issue rather than a Democrat or Republican issue. Supporting healthcare reform means lower rates and better living standards for Americans. Healthcare reform is the key, and it is possible despite the quarrels about how it should be done. Americans have the right to free healthcare, just like citizens of other industrialized countries.